Hello my osteopathic friends, how are you? This is 𝗀𝗂𝗀𝐻𝐿 from Madrid School of Osteopathy, and today we are going to talk about one very important disease. This is every kind of discal disease. So we are going to see different treatments for different problems, different diseases in the discs. First most common, most typical injury in the disc is just swollen disc. When we have a swollen disc, what we have to do? What is our aim? Our main objective is to pump the disc. If this disc is swollen, we must decrease this swelling. And we can do it with several techniques. First of all, we must equilibrate, it's like treat all the muscles that are around the disc. For example, paravertebral muscles with these neuromuscular techniques. We make different traces close to the spine to relax paravertebral muscles 3 times each line in both sides. We can treat as well, for example, the fascia. We have adherences from the skin to the fascia below. We can pull it up. Sacroiliac joint as well at this point. To make like a little thrust of the soft tissues. This is very good to relax all and to decrease pain receptors. Influence of pain receptors are to increase mobility after this, to relax soft tissues. We can treat as well muscles in the hip joint, like piriformis muscle. And then we have to pump the disc. In this case, we are not able to do it with a flexion distension table. It's a pity, but we have 𝐦𝐚𝐿 wedge. So these are my 𝐦𝐚𝐿 wedge. I'm very happy with this because I use it every day in my private, in my clinic, and I like to use it a lot. I'm in love with 𝐦𝐚𝐿, with Bertram de Mayor 𝐦𝐚𝐿, one of the most important osteopaths in all history. So we can pump the disc, putting the wedge like this, in this position, like a V, and we take a contact with my hand, with one hand in the apex of the sacrum, and the other hand is in the base of the sacrum. And in this case, I'm going to pump the disc with my hands and with the help of my patient that is going to breathe in. When he makes breath in, is flexion of the sacrum, then breath out, inspiration, expiration, and I use it to pump the disc. Inspiration, breath in, flexion, I push with my hand, breath out, and in this case I'm just pumping the sacrum, pumping the disc, just using only my hands. It's very easy, it's very helpful for the disc. Another option is another 𝐦𝐚𝐿 technique. Please sit down. We're going to do it in this position. I go to the back of the patient and I put my both thumbs, my both fingers, just in L5. You can imagine there is a swollen disc between L5 and base of the sacrum. I put it in L5 and I press the spinous process up. I keep pushing for several minutes and I ask the same like the other technique to the patient, breath in and breath out, pushing to the back, and I continue pushing all the time. My fingers are pressing to the front, and in this case I am pumping the disc little by little, trying to decrease swelling. Okay, this is only for swollen disc, but what happens if we have a protrusion? What happens if the disc comes out from his place? In this case, we must use manipulation, we must use thrust. The funny thing in this case is that every different injury in the disc has a different manipulation, a different thrust, a different therapy. For example, when we have a protrusion of the disc, what we are going to make is to treat it like an FRS disease, somatic injury. For example, if we have a FRS in the right and we have the disc is pulling, is going to the other side, open the space in the left side of the vertebra, what I'm going to do is to put my patient, please, in your right side, lumbar roll position, and manipulation is going to be like a normal FRS manipulation to close left side and trying to open right side. It's just trying to press the disc to his place again. It will be like this, breath in, breath out, and the manipulation goes in this way. If we have hernia in the disc, if the disc comes out from his place and comes to press medulla, comes to press or nerves in the back of in the spine, what we have to do is to try to put the disc out from these central nervous system structures to decrease pain. This is very difficult, and we are going to talk now. About different manipulations, different therapies for every different kind of this disease, hernial disc disease. So, for example, if we have a central hernia, what do we have to do? In this case, we will use that kind of flexion distension table that we are not able to use now because we don't have it here. We can use 𝐩𝐚𝐽 weights. Remember that when you have a central hernia, you have a antalgic position, protective position in kyphosis. And remember that 𝐸RI test and 𝐈𝐧𝐼 test, this FISA, is going to be positive, but it's not going to be positive maybe in peripheral area. When I make 𝐈𝐳 with central hernia, patient will feel pain here in the back, in the lumbar spine. In this case, I say it again, we make flexion distension table techniques. If we have an internal hernia, this is most common hernia, you will have an antalgic position, protective position, going to the leg of the sciatica, with sciatica. It's direct position, protective position. In this case, what we do is, please put your head there, thank you very much. The leg with sciatica, with sciatic pain, we put it close to the table, and I make a normal technique in lumbar roll. We can use quick step technique like this. It's a pull technique, breath in, breath out, and I make manipulation in this way, trying to remove the disc, to put the disc out, away from the nerve, trying to separate it. In the case I have another hernia, it is like the foraminal hernia, the antalgic position, protective position, is in triple flexion like this, and maybe a little bit in kyphosis. 𝐈𝐳 and 𝐸RI is going to be positive in a peripheral, giving peripheral pain all around the leg. And I have three options. First option is to put the hernia close to the table and trying to open the hernia like this, to open the foramen like this, to release pain. I can put the head in the other side, please. I can put the hernia up, the foraminal hernia up, making manipulation like this in lumbar rolling rotation to open the foramen and trying to release the pain. And if these positions are painful for the patients, what I do is to wait for another, I will wait for 1 week or something like that, for another treatment to manipulate again, to make manipulation again. I will use in this case soft tissues techniques. And to finish, we have the external hernia. External is very uncommon hernia. We don't used to see it a lot. It's very difficult to see one of these. In this case, what we do is to put the sciatic pain, the leg with sciatic pain up, and we will manipulate in this way. In rotation, we can use, for example, a push move technique like this to make that the nerve comes out, make a separation from the nerve to the disc and open this space. And that's all. It's only one thing. It's not so easy to treat an hernia. This video is just to show you that we must make a very good effort to make a good diagnosis, and we have so many different resources to treat discal problems depending on the type of injury that the patient has. And nothing more. Thank you very much. I hope you enjoy and hope